I'm going to present briefly Mojca, right? And I think, well, all of us know Mojca, but it's always good to know people we already know, knowing them slightly better. So Mojca is a medical doctor and a specialist in public health. She also has a PhD in social sciences. Her fields of expertise are nutrition, physical activity, and aging. And currently, she's most involved in health policy and research projects. She holds an assistant professorship at the Faculty of Health Sciences, where she teaches health promotion theory and health in all policies. She has been a WHO national counterpart for nutrition since 2000, and she also holds a position of honorary advisor of the executive board of EuroHealthNet. And in the Best-ReMaP project, she's the leader of two work packages, Work Package 1 and Work Package 5, right? So this is, I think this is the best time and opportunity to give the floor for an introduction to this joint action and what Work Package 7 has achieved so far. So Mojca, please, the floor is yours.
Thank you so much. Albert, for this very nice introduction. I'm kindly asking Monica to share the first presentation just to get a clue where within Best-ReMaP we are positioned as a Work Package 7, where we are leading. And then I will speak more about what are the outcomes of the policy dialogues of the sustainability. So if we just look into that next one, what joint action Best-ReMaP is, we are aiming at improving food choices for children, changing obesogenic environments, as Albert has already nicely said. And Work Package 7 here within that is trying to encourage intersectoral collaboration. And also we tried to test the best practice tool, which was prepared by the Chamber of Commerce and Industries of Slovenia to access more sustainable, high quality, healthy and nutritious food. So next one. As you said, we are almost finished, started 2020, 2023 is our final date, and 36 partners for 7 million euros in 7 work packages. And the next one, just to let you know how many countries are in each of the work packages, you could see that work packages the richest with the countries, 21, then work package 6, 17, and we have in work package 7 just 11 countries, and 8 of them field testing the pilot tool, which we are aiming to present today. And 24 countries altogether, which is really a very strong consortium. Next one. So public food procurements came on the agenda during the Maltese presidency, and there was really a huge discussion among the members. And what we think it's really important that we establish better intersectoral networking and collaboration. You will learn about that more from the partnering countries, more harmonized, transparent implementation of the procurement legislation, and also final goal, improvement of the quality of the procured foods. Next one. So here was the GRC report from 2017. 82 billion euros goes into the public food procurements. It's a huge challenge that we do it best possible. Next one. So the objectives, and I'm not going into very much detail here because really I'm so happy that all the partners are going to present on how they have been challenged by implementing those objectives. The first one, to identify stakeholders and sectors and to establish the intersectoral working group. Then secondly, increase understanding, knowledge and skills. That was also quite challenging. And then after that, only we piloted the catalog of foods. And at the end, where we are now, we are trying to recommend further institutionalized implementation at the EU level. Next one. So that is a very nice picture which started and was drafted by the Chamber of Commerce in Slovenia. You can see that quite a lot of sectors are engaged. Ministry of Public Administration, in our case, the core ministry, but from Ministry of Agriculture to Ministry of Health, many other sectors engaged in public food procurements because they are part of the procedure or they are procuring on themselves. Next one. And that's the catalog of foods. I'm happy the Chamber of Commerce is also here with us today. So if there will be any questions which are more specific on that issue, they will be able to respond. It's an e-tool which allows, next one, for the data collection, with really very defined, clear food product properties as product data, nutritional values, ingredients, allergens, certificates. That's why we were so excited about this tool. Next one is data evaluation. No, sorry, just the next one. The next pillar here is data evaluation, where we have, that's really the key game changer, that we know how to set, to define sets, and then how we use the data. And we have been discussing also the further potentials. At the next slide, you can see that also the quality, not just the price, but the quality is a part of that tool. So we are right now discussing the quality, and we will have to discuss it by the end of July and deliver then our opinion on that, what quality criteria would be really useful. Next one. So that's the picture of the group of the work package 7 participating countries. We've been learning, we've been also having some fun, but I think that we have really made a huge progress in these 3 years. So I'm really thankful to everyone who participated in this process. Next one. I think it's just the final slide. I wanted to remind us that whatever we are doing is will be immediately rolled to the new joint action Prevent NCD, which is coordinated by Norwegians. They are preparing the whole consortium really quite intensively to the start of the new project, and Best-ReMaP policies are rolling on, and the work package 5, task 5.4 will be public food procurement in public setting in EU. And if we have now 11 countries in the new joint action, there are 17. So we are improving also in that sense. So that's everything for the beginning, Albert, before we go into the next presentation. Back to you.
Thanks a lot, Mojca. Well, I think this is a super interesting announcement you have made, that there will be like even more countries in the next joint action in the Prevent NCDs. And maybe just for a couple of sentences, if you could present this, what do you expect from this Prevent NCDs joint action, from this specific task, to make out of what we have been doing in these 3 years together in Best-ReMaP?
Yes, definitely. We are very excited because at the same time when our joint action is delivering the outcomes for Best-ReMaP and Work Package 7, the Commission is planning intensively the new framework on sustainable food systems. So whatever we have produced right now, we have already shared with the Commission, and the learnings were really very well accepted. So they are feeding into the processes at the EU level, the concrete processes, the complete implementation actions, and what is coming out of the EU processes will be then feeding into the new joint action Prevent NCD. So what we have learned till now, we will try to upgrade. It's the network of the procurement officers. It's the criteria which I have just mentioned right now, a lot of awareness raising, and also the whole framework which we are proposing and will be discussed afterwards. But I'm not going into this detail right now because we will have time afterwards.
Yeah, sure. But it's super interesting and very good news at the beginning of this. So this is what I just wanted to reflect on. Thanks a lot. Thanks, Mojca, again. Okay, so now I think we can then go right to the country level presentations.
Albert, I just have one short presentation for another 5 minutes on what we have from the analysis, if I can, and then the member states presentations.
Analysis of national level policies on Work Package 7. Yes, please go ahead.
Yes.
If I policy dialogues. Yes, please go ahead.
Yes. Just so that I'm also highlighting exactly the question you have asked me, how the sustainability of this joint action could be provided best. So next slide, please. How we are in fact leading the work of the Best-ReMaP in the last year is that we have prepared the survey, and here I'm really thankful for the Work Package 4 core team, specifically EuroHealthNet, who was working on this analysis. So that was produced by Dorota Sinkiewicz and Samuele Tonello, but they have implemented the survey and analyzed the survey of the national competent authorities. What do they see in the policy area? And then also they took everything, they prepared specific template where the work packages 5, 6, and 7 were reporting on what are our outcomes. So we are discussing those both in the policy dialogues. I will show you a bit more after, and then that everything will end up in the final report with the recommendations to the Commission. So next one. If we just go for a few minutes to the public health policies in nutrition, food sectors across EU and the member states to this survey, next one, is that we have collected and analyzed responses from 24 partners. It means everyone was responding in different sections of which policies are implemented in the core work package topics. What is with the implementation, because the questions were really targeting the concrete implementation processes, gaps, identification of the challenges and of the opportunities. And then of course, the briefs were prepared and discussed during the dialogues, and we also will have today a small chance to do that. And the SWOT analyses were prepared, so I will show you also a piece of that. Next one. What were the key opportunities from the surveys which member states identified? It was the concern about the lack of regulation for the food environment outside schools. So it's not what we are doing within public food procurement work package, but it was the message: you have invested so much, so the schools will be okay, but please don't forget about what happens when the child gets out. Secondly, price not held as the primary only criteria. So price is the only criteria that was happening in quite a lot of partnering countries, leads to something better and more. And how to harmonize EU directives into national legislation is the same directive, but the transposition obviously seems different. That are the main challenges. Next one. So here is the framework. I'm not going in the detail because I have 5 minutes afterwards, after the country presentations, but the framework, which we are going to work with also in the new joint action, back to your question, Albert, is built from the landscape, legislation, recognition, networking, then knowing the implementation approaches and defining tools, and then evaluate. But we will go further during the program into the details. Next one. I would just like to report to you what was the analysis outcome regarding this proposed framework. The key messages are that there is a value of an intersectoral public procurement hubs. So it's really how to facilitate knowledge sharing, experience, capacity building, exactly what we are doing during the year and right now too. That we need for an aligned and improved implementation of the unified legislation. Main message from our work package: we differ so much that we could never imagine when we started our work, but we can do something more. And also we need for government, there is a need for governments to guarantee a sufficient budget. It means that we need also more funding, different capacities to make it better. Next one. So the questions we are always asking ourselves now during the dialogues, and we'll do that also in Brussels next week. Do we have at the EU level, at the member states level, resources, instruments? If not, what is missing? How to address those challenges? How to the cooperation across countries could maximize our synergies and so on. So to propose instruments, that will be the discussion in Brussels, and we are looking very much forward to that next week. Next one. If I just go slightly to the draft outcomes of the Rome dialogue, that was the first of the dialogues because we had for the Mediterranean basin. Next one, we will show exactly. The Mediterranean Europe, that was end March, then Central Europe was last week in Vienna, and Northern Scandinavian Europe was first week of May in Helsinki, and EU overall final dialogue will be in Brussels in few days. Only from the Mediterranean Europe, we already have the analyses. The other dialogues are still in the draft phase of the reporting. So just to let you know and to give you the flavor of these three regional approaches. And it's interesting because during the dialogues, we have really noticed that we differ regarding the attitudes towards food and our policies if we are coming from different parts of Europe. So we hopefully will be able to report more on that. But just to give you the flavor of what were the discussions going on, my final slide here is that we have been discussing strengths, weaknesses, opportunities, and threats. And it's interesting to see the strengths we know more. That were the messages. We know more now about all the policies, and we have the EU frameworks for action prepared. We are sharing knowledge, explore together. We share expertise, so we share experience. That are our strengths. Weaknesses, on the other side, are that smaller countries do not have resources. The question overall. Low collaboration among ministries, that was also observable. Know-how was specifically know-how, how to share it with private sector. Are we reaching small and medium enterprises? It's time consuming, progress is low, so what to do to motivate us better? And also interconnection between the three policy fields of Best-ReMaP maybe still can be improved. That's from our side, but from the external world, opportunities for Work Package 7, not much more to harmonize. We are already almost there, but is there any regulatory governance body or something else available? How do we start discussions at national level? Because we have joint directive, dialogues, scientific data, how can we exchange frameworks, how do we implement, but together we are stronger, and some role of EFSA was missed. And for the threats, it's that what we are also going to discuss next week in Brussels. Do we have enough high-level support from different DGs? We have noticed that we have a lack of networking of the high-level nutrition officials from the countries. Official responsible at DG Santé is somehow missing. Economic crisis is also important, and equity inequalities, that was also quite of a concern. So next one, I think that was everything from the sustainability point of view on what we are trying to do at the moment to understand what's working, what's not working. But I'm sure that Albert, you will be leading nicely the country presentations, and I'm looking very much forward to our partners to present their experience in the 3 years' time. Thank you.
Thanks a lot, Mojca. This was really a very, very interesting, great presentation, and listening to it, I think for everyone, as we listen it sometimes a couple of times, now it's getting very clear, the landscape that we need to face now and also in the next joint action. So now, after Mojca's presentation, we'll be listening to country-level presentations. So we'll have Austria, Greece, Hungary, Finland, Malta, Poland, and Denmark. So 7 presentations all together. And I would like to then announce now Gabriele Antoni, who is a project coordinator and researcher at the Austrian National Public Health Institute. And she's going to make a presentation on a situation analysis on Austria. So Gabriele, please, the floor is yours. We cannot hear you, I think. Hello? Others? Anybody hear
this is a recording. Do you not hear it?
No, I didn't hear the recording. No.
Okay.
You have to, when you share, I think you have to click on share. You have to share also the sound when you do the sharing. There is like
okay, yes. Now it will work. Sorry.
Yeah, we have two countries who are not able to participate today, so we have 2 pre-recordings, but the others are here to present on themselves.
Hello everybody, my name is Gabriele Antoni. I'm working at the National Public Health Institute of Austria, and I'm part of the Austrian Work Package 7 team of Best-ReMaP. Due to a national holiday, we are not able to participate in today's webinar, but we are kindly asked to record our key findings of the situation analysis regarding public food procurement in Austria, with special focus on kindergarten and schools. At first, I want to mention that we do have a compulsory education for children in Austria that includes 1 mandatory year in kindergarten and 9 years in school. So at the age of 5, the children enter this compulsory education phase. But when we are looking at the younger children between the age of 3 and 5, we see that 93.8% are already in daycare. Daycare in kindergarten is regulated by state laws. We do have 9 states, the so-called Bundesländer, and the state laws differ in details. For example, in Lower Austria, daycare is free of charge for children older than 2.5 years for half of the day. Lunch and care in the afternoon is an extra charge. Regarding the school, the education is regulated by federal law, complemented by state laws. And these state laws also formulate competencies for the municipalities. When we're looking on food procurement, there are some general regulations, like the Austrian Federal Public Procurement Act, that regulates all procedures for procurement of services in the public sector, and also contains the EU regulation. We do have specific plans, like the National Action Plan on Public Procurement, that is binding for federal institutions, and it includes a section on food procurement and catering services. But we also have plans and targets at state level and voluntary guidelines for healthy food in specific settings like kindergarten and schools. This graph shows the different levels on which public food procurement takes place. For the Work Package 7 activities, it is important to state out that we have more than 2,000 municipalities that are responsible for food procurement in various institutions, also schools and kindergartens. When we take a closer look at the lunch in kindergartens in Austria, we see that there are different ways for providing the lunch. 15% of the kindergartens do have own kitchen and kitchen staff, and the other ones are providing the meals via local restaurants or catering companies, or from kitchens of other public institutions like hospitals or residential homes. In our Work Package 7 activities, we perform interviews with municipal staff and caterers to get a deeper understanding of their daily business. In this context, we also included a description of the catalog of foods of Slovenia and also gathered their view on such a catalog of foods. The tool has seen useful, especially for smaller and or newer caterers, and they report that the change in the menu to health promoting more sustainable dishes requires time from experts, but is manageable for them. They also mentioned that there have been difficulties with finding producers willing to cooperate in the past. Regarding our pilot research in Work Package 7, we take a look at the catalog of foods in the pilot version and have seen that it is user-friendly, and it seems necessary that there is room or space for adaptations to different national food markets. We also organized a roundtable with relevant stakeholders and the public food procurement expert Bettina Bergmann-Matzen in February this year. It was a fruitful exchange and gained insights in the procurement processes. At this event, we also presented the pilot version of the catalog of foods from Slovenia and got in general good feedback from our participants. But they also mentioned that it could be overwhelming for smaller institutions or units in Austria to use such a tool. For implementing such a tool, the cooperation with Chamber of Commerce and the Chamber of Agriculture seems key. One participant also reported from the dynamic, which is at the time piloting for food procurement. The main goal of the system is to support the legally compliant procurement process, and obstacles are seen regarding the inclusion of regional producers and small and medium-sized enterprises in this procurement system, regarding know-how, human resources, and so on. Thank you for your attention and have a nice webinar.
Well, okay. I wish Gabriele was here in person to say her thank you, but she's not here anyhow. So we just, I think we just move on, right? That's this. We go to the next presentation, and it will be a presenter from Greece, Eleftheria Papaschristotou, project partner at the Harokopio University of Athens. So Eleftheria, please, the floor is yours.
Hello, I will share my screen, just a minute. Okay, great.
Thank you. Looks good.
Okay, so this is a presentation made from my colleague Venetia Vraila and me. So we work at the Institute of Child Health for Best-ReMaP project. And for the next few minutes, I will share with you our efforts on making the intersectoral working group in Greece. So first of all, this is the Greek team, Adamantia Xekalaki, Venetia Vraila, Giannakoulia Mary, Kondogianni Meropi, and me. So we're working, we all work for this intersectoral working group. Now, some, let's say, thoughts about how we organized this. First of all, we had to identify the relevant sectors. And then we had to contact the key officers across sectors. So we thought that the best way to do this is to contact by first time and made an introduction. And then we tried to find the right person for this group, which wasn't always that easy. Then we made a formal invitation for participating in the national meeting where this group was formed. And then we also informed them during the meeting for this working group. This working group met last year at Harokopio University during our national meeting. So we included Ministry of Development and Investments. We included the Ministry of Health and especially the Department of Non-Communicable Diseases and Nutrition. We also invited Ministry of Agriculture and Food. They do have a national program for fruit, vegetable, and milk distribution in schools. We also invited the Hellenic Food Authority because they work with food safety issues. In this group, we also included some municipalities, Municipality of Athens, Kalithea, and Kessariani, which are also the municipalities that will work with us in the pilot procurement, and also Harokopio University. So finally, this national intersectoral group has some public procurement experts, public procurement officers, dietitians, food technologists, and doctors. Now let's talk about some difficulties and obstacles we faced during the organization of this group. First of all, public food procurement is a new field for Institute of Child Health. And also these new tools and new, let's say, things about public food procurement are new for our country. Secondly, it was difficult for us almost every time to find the right contact person in its ministry and institution at the beginning, but I think that we have managed this well. Also, when we first contacted the persons for this group, there was initial doubt and there were some disbeliefs on how and whether this intersectoral group could be useful and make some difference in public food procurement in Greece, since we always have the lower price criteria, and it's a little bit difficult for this to change, at least for now. Moreover, all the members of the working group actually represented their institutions and ministries, so they had to be a little bit careful on their statements, and there's also a lot of issues with attendance or maybe permission for attendance and things like that, which are making this process a little bit slower, let's say. And last, there is a heavy workload of all the members of this group, which is making a little bit difficult for us to organize more meetings, more maybe huge meetings, because we have managed to organize some, let's say, one-to-one meetings during this time. And some future insights for this working group in Greece. We believe that Institute of Child Health is able to support this intersectoral working group with the dissemination of any information of public food procurement. But what is important is that in Greece, we do have this lower price criteria. And in any argument or anything we say about maybe organic products or smaller producers, there's always this obstacle of lower price. So by observing the example of Slovenia or maybe Denmark, we actually understood that there is need for strong political will to support changes in public food procurement, in Greece at least. And we think that maybe this intersectoral working group is not enough, but it is a start. It is important that there was great interest from this group, great interest, and this gives potential on public food procurement. But it might be possible, and we're thinking about this, it might be maybe needed to engage producers and industries that and this is something we didn't do at the start. And we believe that maybe engaging the Chamber of Commerce would be something that we need to do in order to support this intersectoral working group in Greece. Thank you.
Thanks, Eleftheria. This was a very interesting discussion. And I think we all agree that you made the first necessary steps by setting up this intersectoral working group. And it's good you had a critical eye and then discussed what else should be needed, to make it even more efficient. But I think this is where many countries are. They're just starting setting these working groups up. And I think this is why the joint action is there to learn from each other. So thanks for being open about your issues and concerns and what you have future plans. So that's good to hear. So congratulations. Okay, so we move on. The next presentation will be by Leonora Zambo. She's a dietitian at the National Institute of Pharmacy and Nutrition of Hungary. And so Leonora, please, the floor is yours, and yeah, make your presentation.
Okay, thank you. Hi, everyone. I'm Leonora Zambo, and on the behalf of the Hungarian team, I will present our experiences with the participating public institutions. This time, I haven't prepared slides, but I hope that you'll be able to enjoy my brief summary about the topic in this way as well. So to tell you the truth, it was not an easy start, because finding a public institution who could participate in the project was a bit challenging for us. And the challenge we had to face with was to meet the criteria that were set out in the work package. One of the criteria was to select public institutions that provide meals for children. And besides this, another criteria was to select public institutions who purchase food with public procurement. And this was a bit problematic, because just like in several countries, in Hungary, the procurement of services is also very common. Furthermore, we had a hard time to find the right institutions, because in Hungary, there are lots of large central kitchens where meals are prepared for thousands of people. And where the service is not procured, the cost of the food to be purchased doesn't always reach the EU threshold, which means that these institutions are not subject to public procurement. Moreover, in many cases, it is not the institution itself, but the maintainer is responsible for the public food procurement, for example, the municipalities. But in the end, luckily, we managed to find the institutions who met the requirements. And finally, 5 nurseries from the capital city were involved, where the municipality is responsible for the public procurement of the food. And the selected institutions belongs to the Budapest capital 18th district municipalities united nurseries. The 5 nurseries have been applying public food procurement for about 7 years, and their superior institutions are the municipality and the economic supply service. It is also important to note that all nurseries have their own cooking kitchen. If you allow me, I would share some difficulties they have to face with day by day. One of their biggest difficulties related to public procurement is that the daily natural material norm in public catering is very low, and therefore they have a really hard time to provide healthy meals with proper quality. Although their intention is very clear, children have to get a good quality of food, but while the expenses keep rising due to inflation, price of human work, materials, and additional costs, unfortunately, the daily natural material norm is not following the rise of costs, and the prices are rising day by day, and this is putting a sharp limit on their already tight annual budget and raw material norms of public institutions. But in spite of all of this, they are very happy to participate in Best-ReMaP project. They find the food catalog very useful, which could also would be a help in public procurement of food in Hungary. And it would be a huge advantage regarding the food market analysis prior to the food procurement, and for example, also to prepare the documentations related to the public procurement. Anyway, the relationships with the selected institutions are excellent. The main food coordinator of the institutions is always on hand to help us, and we keep in touch regularly with her. We have several meetings online each month and by phone, and we also had plenty of meetings in person with her. We also have an external expert in procurement. So he's a procurement expert, and he's also involved in these meetings, which is very favorable because every time when the food manager has questions, he can help her in the questions. So the cooperation between them, I can say, is really good. And in addition, both of them participated in the intersectoral meetings and in the stakeholder event, which was organized by our institution in the framework of Work Package 2, and it was held 2 weeks ago. And both our external expert and the food manager help us to gain more in-depth insight regarding the public food procurement. We've been able to work with the institutions very effectively, and we had to, for example, when we had to develop the food categories, and actually during the pilot project, the joint related to the joint public tender, we also started to define the specifications of the products, for example, the maximum sugar content of fruit yogurts, salt content of cheeses in professional agreement. And if you let me mention just one last note, I would note that the real dairy procurement of the nurseries will be launched in autumn, and we will therefore continue to help them with the experience we have gained from the project and from using the food catalog. And we hope this will help the institution to give children access to healthier food in the public catering. So thank you for the opportunity that I could share our experiences, and I give the floor back to you. Thank you.
Thanks a lot. Thanks, Leonora. It was really nice discussion, going through some struggles at the beginning, but then finding a district and then these 5 nursery homes that were ready to work with you. And I think this is a very interesting segment, right? Because for nursery schools, maybe requirements should be different, food should be slightly different from than for older ages. And I think it's good we have this experience from the Budapest capital city. So thanks for, again, for sharing your experience. And now we move on then to Finland, right? And we'll be listening again the video recording by Eva Rantala, who is a researcher at the Finnish Institute of Health and Welfare.
Hi everyone, greetings from Finland. Our THL's team was unfortunately unable to attend this webinar due to national holiday. So we are sending our contribution via this video, in which I will talk about the rationale behind our decision to conduct the Work Package 7 pilot focusing on fish products instead of dairy products. A key challenge in the public food procurement in Finland is the inclusion of small local producers in competitive tendering processes due to our highly centralized procurement environment. So the National Intersectoral Public Procurements Working Group that we established in the beginning of the project, they suggested that we could try and find a way to focus in the Finnish pilot on supporting the identification and the inclusion of local smaller providers in the procurement processes. Well, dairy products then appeared a bit challenging food group for us to achieve this suggested aim, since the production of dairy and the procurement of dairy products is again highly centralized in Finland. So the idea of achieving the goal to support small local providers did not feel feasible. Also, the pilot participant that we had, the catering service of the municipality of Muurame in central Finland, they already had a long-term contract with one of their nearby dairy providers. So they, in a way, did not have the need to find further dairy products. So we started to think of other opportunities and came up with the idea of fish, and then proposed this, and luckily our proposal was accepted. Well, the reasons for focusing on fish, they were many. First of them was that fish is nutritionally beneficial, health promoting source of numerous essential nutrients such as protein, unsaturated fatty acids, vitamin D and iodine. And our national nutrition recommendations recommend consuming various fish species 2 to 3 times per week, but a very small proportion of the population actually achieves this goal. So there is a need to promote fish consumption. Another point was that fish is a sustainable, environmentally friendly alternative for meat, particularly if we focus on fish species that are sustainable and fish that has been captured sustainably. Well, the third point was that the utilization rate of fish in public catering services in Finland is low, and the inflation tends to further reduce the provision of fish in public catering services, for example, in schools and in early childhood education and care. Then we had several national and international goals and programs that would benefit from our efforts to support the procurement of local fish. Some of the national goals include our government's aim at achieving a carbon neutral Finland by 2035, and then government programs that aim to promote local food, local fish, and a climate food program that aims to support a just transition to a more sustainable food system. And then, of course, the international goals, which are familiar to all of us: UN Agenda 2030 Sustainable Development Goals, European Green Deal, EU Farm to Fork Strategy, and the EU Green Public Procurement criteria, focusing on fish in a way supported and fitted quite nicely in this framework. So that's it. I wish you all a fruitful webinar and look forward to meeting you all again. Bye.
Well, okay, this was a nice presentation by Eva. I hope, I just wonder how many countries have like a day off today, but Austria and Finland definitely. So we have heard that fish, at least in some countries, next to the sea or ocean, fish can be a great solution if inflation is not blowing away. But like 2 or 3 times a week, eating, catering fish is a great food, great nutrition. It's a good example from Finland. Okay, so here we go for the next presentation. Now it's after Finland, it's going to be Malta, and Charlene Vasallo, who is a researcher of the Ministry for Health, she'll be covering the topic of how they'll be using the catalog. So Charlene, please, the floor is yours.
Yes, good afternoon. I will try to share my presentation. Do you all see my presentation, please?
Yeah, we can see. Just put it on. Yeah, perfect.
Yeah. So today I will give you an overview of how we use the food catalog in Malta. And okay, so we know that there's a rise in obesity in childhood, and the WHO, together with the European Union, have called for population intervention, whereby this intervention is to ensure that healthy foods are more accessible. To be more accessible. Following the Maltese presidency, discussions were held along the years, and an effective measure is to implement the healthy food procurement policies, whereby if they are implemented in institutions, this will improve the dietary intake in children towards a better healthy eating. So here I will highlight some advantages of using the food catalog. With regards to nutrition, it is to encourage a healthy food procurement towards healthier food service environment. Reformulation, this is an opportunity to improve the food products that are to provide them that they will be low in salt, sugar, and saturated fats, and especially in industrially produced trans fatty acids. With obesity, this is another aspect to combat obesity silently and to lower the stigma that we have a lot of high obese children, and perhaps children, they will be a little bit sort of scared and offended. So this is another technique how to fight obesity. This food catalog, I think, and to my knowledge, is important to address inequalities, because if this food procurement is equipped with the right nutrition, then the vulnerable children and those that are at disadvantage, when they are in schools, they will have a proper meal, or even during school hours. And for economics, for the business to install innovation for the industry to prepare innovative food with the right nutrition information, so that they will make better food choices. So what is the benefit of this food catalog? In Malta, we don't have such catalog. So this is the first experience for us. And I thank all the Work Package 7 leaders who helped us with creating and getting the knowledge of how to use this food catalog. So from our experience, this is an online application. It facilitates the process of procurement and makes it more transparent. And it saves times when preparing for public food procurement. The application enables the fast preparation of public tender documents for the public institution by inserting the correct food types with the property specifications and quantities in grams that are available in the current market at that moment. Member states are invited to implement these food category, but they need to do the country adaptation. And also, this is to present your products on a user-friendly platform. So here I'm going to discuss the steps needed to edit the food catalog. We were able to edit the food catalog with the help of bilateral meetings by the Chamber of Commerce. We started contact with the Maltese and local milk industry. In Malta, we only have one local milk industry, whereby the 89 farmers delivers the milk to this company, and then this company will prepare the desired food, milk and milk products based on the Maltese population needs. In order to edit this food catalog, we were able to use the industry website where we were given permission to collect the information like the nutrition information, the quantities, and other information needed so that we compile the nutrition composition database. From this, after several checks and market sharing, we were given the permission to import the collected data. The permission was provided by the Chamber of Commerce and their team, so that we import the collected information, and this is based on the food category. Following this, then we were able to create the pro forma invoice by creating data sets. And this I was helped by the milk industry, where they provided us with the barcodes and the selling prices, so I could perform and create this pro forma invoice. And here are the steps needed for us to create the whole scenario. The identified food category was the milk and dairy milk products. This was discussed at the initial meetings with the work package leaders in May, June. From there, then we were guided to develop the subcategories. And for Malta, I haven't identified 7 food categories, whereby from these 7 food categories, we were able to create 57 food types, which were needed for this software. Then we were able to edit this food categories. Also from the website, I was able to collect the information, as I already mentioned, together with the picture. So when I imported all the information, you could see the picture together with the nutrition information. And I think that it is very fantastic. So the challenges we encountered, and some of them relate to other countries as well, is that we need trust, and there needs to be trust and familiarization by stakeholders in applying and use this tool. Because in Malta, I would like to highlight for those that haven't heard me before, in Malta, there is no meals provided in schools, because the school hours in Malta is between 7:30 in the morning to 2:30 in the afternoon. So children are asked to get their prepared lunch, but based on the legislations that the superintendents of public health, together with the education, the Ministry of Education, have prepared. So they have these regulations so that when there is the procurement, they adhere to the information that is requested. There needs to be commitment by the local authorities involved in the procurement. There is lack of time and limited human resources to support this development within the Ministry of Health and other sectors. The procedure needs to be further simplified. There needs to be an update with the new food products in the market, so this needs to be ongoing, and informative information needs to be provided if this needs to be implemented for the food for the public officers, so they will get the know-how. Also, we need to address and get involved them and get them the opportunity for the small, medium enterprises and the local farmers. And I think that this is an opportunity so that these small enterprises will start to compete and produce other food products. Please note also that in Malta, 75% of the food is imported from other countries. Also, due to the small size and the country, there may be some problems with the climate, and the environment. And based on this, with regards to our animals, they need food, and this depends on the scenario across the Mediterranean islands. So I thank you all for your attention. And thank you for this opportunity to have expressed our journey throughout these 6 months. Thank you very much.
Thanks, Charlene. This is very interesting, and also you're discussing impact on climate change, size of island of Malta. Very interesting. Maybe just something for my understanding. You mentioned that in not every school you have a catering available, and parents are doing the preparation of food.
Yes, in Malta there is no kitchens in the schools or kindergartens. For primary schools, we have all children, primary and secondary schools. They get their healthy meals, packed lunches from home. We have a breakfast club in the morning for working mothers, so that they can take children before school starts and the mothers can go to work. And for that, we have healthy breakfast like cereals or breads. But these are based on the dietary guidelines for the school children. Then we also in Malta, we participate in the fruit scheme, the EU fruit scheme, and once a week they are offered a piece of fruit. But there are the environmental officers that they do regular checks in schools to check and spot some lunches to see if they are in line with the dietary guidelines. Some meals are provided for around 500 children in Malta who fall in the scheme 9, we call it, and these are a little bit deprived and vulnerable. And the meals offered to these children includes either some wrap, some pasta, and a piece of fruit.
Okay, thank you very much. Thanks for this clarification. Okay, thanks a lot. So now we then move on. So after Malta, after the great presentation on Malta, now we have Poland, and it will be Katarzyna Brukalo, who is a researcher at the Medical University of Silesia and at the School of Health Sciences, and then she'll be presenting working with the industry, experiences of working with the industry. So Katarzyna, please, the floor is yours.
Thank you so much. It's really nice to see you once again. I will try to share my screen. I hope that you can see.
Yes, absolutely. Good.
So I would like to show you our work with industry from the Polish perspective, because it was a huge challenge. We have exactly the main problem from the scientific perspective, because industry is exactly somewhere between money and politics, and there is a lot of conflict of interest and conflict of business, and how we can work with them and how we can deal with it, and maybe we have common points, how we can choose it, and how we can find it. There was the first of our questions. And we have exactly need to say that there is all about money. So of course the industry is working because they are from the business perspective looking. So we have exactly the two ways of the industry with cooperate. So the first one is catalog of foods, and they were working with dairies. It was also mentioned by Marta, by Charlene a few minutes ago, and intersectoral working group, expert group with the working with catering providers. And it was something what was mentioned by Hungary, if I could, oh no, by Greece, if I could remember. So if you would like to talk about the dairies, we tried to connect and we tried to contact with the 10 biggest dairies in Poland, also with small dairies, but they do not look any benefits of using catalogs of foods in terms of Polish regulations. So there were a very, very little interest. Of course, they would like to be in touch and they would like to be active, but no in terms to fulfill the catalog and to do it in just for demo, because to be honest, in case in law in Polish regulation, the dairy products is buying by wholesalers, not exactly from the direct from the dairies. So that's why that was a problem. But on the other hand, we have a very, very surprising that maybe someone one day will become the legendary, and we can use the catalog of food with all the data from the Polish perspective also. On the other hand, we have the second way. So we have the second meeting of intersectoral group. It was had 20 of March, and I was invited the people from the catering companies. And I remember when I'm talking about it with the president of the Polish Society of Dietetics, and he told me, "Oh, why do you do it? Why did you do that? It will be a problem. There is also a very, very hard partner to talk and a very hard partner to networking." But to be honest, the catering companies which we have invited, it was Impel Group and Rekip Polska. There was Rekip Poland. That was really commitment from them. That was very, very exchange of experiences, very active participation, a lot of good ideas, a lot of good points, also from the very, very practical perspective. And what we can see, it was the huge corporate social responsibility. And I think that is the common point. So on the very, very beginning and very late, I have asked the president of Impel and the president of Rekip, why are you such active, and why are you support me in this intersectoral group? And they said that it's the first time we've sat down at a common table with intersectoral experts and started talking about changes. So the key sentences of my presentation, I would like to stay with this, that let's see at the table, let's meet and let's talk, because this is the solution for every problem, and not even from the private, but also for public perspective. Thank you so much.
Thanks a lot, Katarzyna. It was very interesting, and it's good you presented. You had basically a success, right? Because of this project, having people sitting around the table, possibly for the first time, and discussing it. So yeah, you were kind of part of this. So congratulations, really. Yeah,
it was not very, very straight way, but I hope so that by the end it will be a success.
Yes, let's hope for it. There are new projects coming, so it's never ending. Opportunities are never ending.
Yeah, we are ready.
Okay, so we have the final presentation. Last but not least, we have Bettina Bergman-Madsen from the municipality of Copenhagen, and she's talking about sustainable and healthy public food procurement in Denmark. So Bettina, please.
Thank you very much, and I'm happy to be here. And in Denmark, we also have a day off, national holiday, but
you are a good example. Thanks.
It is fun to be here. So I actually created a short presentation. I don't know if I can share though.
Yes, you can.
My presentation, it looks funny, but maybe I will try to see if it works.
Yes,
Hold on a minute.
it starts working.
There
you go.
I think this was it. You see it?
Yes, yes, please. Yeah.
Okay. So for Copenhagen, as you know, we have a lot of...
Bettina, can you put it in the presenters mode? It means left, right, left, up.
Better?
Yes, perfect.
Okay. Because I cannot see you now, so just interrupt me if, yeah, something's wrong or if it doesn't change anything. But now listening to all of you, I actually want to change my presentation, but that's how it goes sometimes. I will try to do it shortly because, you know, we have all these high political goals, especially in Copenhagen, but it's actually spreading through Denmark now. During the last couple of days or weeks, we have had several intersectoral meetings across the whole food chain, actually. Because, you know, like from way beginning, we had this National Food Procurement Officer Network. It works really well. We share ideas on how to do green sustainable procurement and to implement all these criteria that you heard about so many times that we are working with in Copenhagen. But now that it is spreading more, we are actually beginning also to talk with the whole food chain. So we talk both with the supplier, which can be the wholesaler, but also the producers who actually produces food, for example, milk, dairy products, or potatoes, for example, and so on and so forth. So now we are looking into how can the whole food chain start to shift through and with the demands that we are asking in procurement. We also, all of us, use not only price when we put out things out for competition. We all say price is a smaller part. Actually, the new procurements that we are working with in Copenhagen, price will be 30% of the evaluation. The rest will be on environment, diversity, and quality. So this is important because, of course, price is important, but then when you look at the market situation, price doesn't differ that much, only if you eat really not very good food. So if you pay the right price for the food, you will get the right quality, and then you can put your measures on more environmental friendly issues. So, and then we, of course, like I said, value seasonality a lot, and we talked about this, how to do this. We still believe that it can be measured by people who know how to taste. It's not like me, like a lawyer, but it's more like the kitchen staff or people who are trained in tasting food, and that is so often be maybe 25% of the evaluation. We have the new dietary guidelines from the ministry, and that's our National Food Procurement Office group is also very closely linked with the ministry. We are talking very much about finding our focal point, our person to go to in the ministry, because right now I'm linked with the environmental ministry, but maybe it should also be the Ministry for Food or even also competition. So we're talking about how can we do this cross-sectoral thing at ministry level, at state level, because when things are changing at the EU level, as we know it will here in our group, how will it be implemented in Denmark? Where will it reach? And then how can we get that news spread to the procurement officer network? So these are some of the things. And this dietary guidelines is also a very good example because that comes actually from the Ministry of Food, and it has reached everybody's desk. There has also been a lot of commercials about it, like public commercials, that it is now also for the public kitchens. It goes with, it's not just for us eating more healthy, but it's also eating more sustainably. So that's why it also only shows chicken and fish and very, very little of beef, because that's how our diet has to change. We're looking into protein transitions in another project where we are trying to calculate what does it do to the price shifting these diets. Will the price become a little lower on the food that we buy, even though the prices are rising now? But how will it then affect the workload of the kitchen? Because now they have to deal with more greens and lentils, and it takes longer time to prepare than to just put a beef on the pan. We're looking into this. Maybe it's a null sum, but we don't know yet, and we will share this, of course, also with the European Food Procurement Office group when we reach to a conclusion. We look very much into diversity and seasonality. As you know, it is important that we have many different kinds of vegetables and greens when we do food. And then, of course, it's so important that we prevent food waste. We talked about this also at the meeting with both the producers, the suppliers, and us, because what we put in demand in our contracts can have an effect all the way to the field. If I put too high standards on a standard quality, for example, as a standard size, then they will have a lot of goods they cannot deliver to us. And if they have too many different sizes, then we cannot prepare them properly in our kitchen. So it's a really good talk, and we are trying to find common solutions that can then be spread through our networks when we find them. It's really interesting work. We also talk about how long time should we have left on the shelf life. So this is some of the things we're looking into also. We look into packaging. We had a lot of discussion because some of these people from this group are also very high level, and they are seated in some collaboration with another aspect of the EU that are working on some standard packaging rules that gives the packaging responsibility to the people who are producing, which will eventually make our prices rise. So now we have to figure out in the municipalities and in the cities how to shift the money that we usually use for garbage collection over to the money that we use to buy food from, because now it has to be the producers who are actually collecting the garbage. So all these things we have to work with within procurement and know about. So we can share more about this when we know it, but now we know that it's coming, and it's coming all over Europe. I know other cities or other countries, they are already working with this, but this is quite new for Denmark. So we are looking for solutions. So if some of you have any, please let me know. We're also looking into transportation, green transportation, of course, and making sure that it can be as green as possible. And then we have the potato tender. And you know, I love talking about my potato tender, but it's really important that we strengthen the market and that we can hopefully make more direct contracting where it makes sense in our countries, not just potatoes. But I thought it was fun because we now made this potato kit, and I wanted to show you the pictures because I talked so much about it. So finally, because of this contract where we linked it to the teaching, actually, we made sure that the kids could get this bucket, get some dirt, get 2 potatoes. They made their own bucket and built their own Mr. Potato Head, so they put the eyes and the mouth on themselves and the sun, whatever they want, and then they write their name, and then they plant the potato and take it home with them and grow it, so that they both get the feeling of growing the potato. They eat the potato through the tender material that we made in the classroom, and hopefully by this they will gain more respect of the food that are served to them. This is at least what we wish, but we are also we have a scientist following this to let us know if this works or if we should put it in a different way in the tender material. And then we try to do fresh fish in season from small and medium-sized enterprises. So we'll just get delivered an unspecified box of fish. And then we make sure that the kitchen staff, they have plenty of recipes so they can know how to cook these fish, and if what fish can substitute another. So if they get caught, then they can substitute it with some of the other fish that looks like it. So these are some of the things, but all of this, most of this is gathered in the teaching material that we announced last year in October in Best-ReMaP also together with WHO. And this we are working on sharing with as many procurement officers as you know, and as I know, through the European Food Procurement Officer Network. And then, of course, we have to also have a focus on contract management. How can we make sure that all this is happening correctly, because one thing is writing it in tender, but if you do not follow up, then everything is it doesn't make any sense to do it. But we will do it together, and with the Best-ReMaP procurement officer network, where we have our next meeting. I can see this slide has been much too big, so I'll just stop sharing because I'm not finished talking yet. Because what I wanted to say is we have the next meeting on the 30th of May, and it looks like a lot of people are also joining. But one interesting thing I can share with them is now we are trying to do the diary products, because this was our test in Copenhagen. We built a machine that can read the GS1 data so that we can electronically from the big database of GS1 transport the goods that we want to buy into the list of goods that you are also producing in Slovenia. So from the Slovene case, we really took a very best practice of what you're doing. It's not functioning perfect yet or at all. We still look to your thing and think that's excellent, but we're trying. And the best thing is that now all the, like in Denmark, at least GS1 is owned by all the companies that deliver data to them. So in Denmark, it's a non-profit organizations, even though we talked about before that they sometimes work like they are a profit organization and earn money. But now actually all the partners, because they know us and because we talk with them through this food chains, like the meetings we have, they contacted GS1 and said they wanted them to change. They wanted them to work with us, and it should be free for all municipalities and government officials to use the data. This is really impressive news, and I think this is, or I don't think, I know this is thanks to this project, because otherwise we would never have contacted them. So imagine what impact this could have potentially if the companies, because the companies, they see a point on sharing data at one place. And then we talked about maybe it should be at an EU place where they share data, and then GS1 can get it and others can get it if they have the right interest and treat it the right way. That is not for me to say, but that could be. It is so important that the companies now also see that it is a help to have an electronic database where we can draw statistics from and can draw our list of goods, as we talked about so much. So the case in Denmark is coming along really well, and we are very happy right now to be here. And hopefully we will press on the button before the end of this project on our electronic created list for the diary products. That is our fully belief right now, at least. That was it.
Okay. Thanks, Bettina. This was really great. I remember you were one of the first persons I met when we started Best-ReMaP project, and even then you were very enthusiastic and said that it's really time for experimenting, and there are lots of things that can be done. And congratulations, it looks you have really done a lot during this project. So it's good to see things are going a perfect direction. Okay, and thanks a lot. And now I think before the very short mini break, because I think we are like 10 minutes, even more, like 15 minutes late, we have a short introduction on the framework for action in public food procurement. I think it is going to be you, right?
Yes, thank you so much. And I have to say that I'm following really, as the coordinator of this work package, the work very closely, but I'm always impressed when I'm listening to the country presentations and understand how much has been done and how diverse we are and what we went through together. And I'm really so happy because many of you have also highlighted the importance of the tool, of the best practice tool which we have shared And it's good to see that it's working so well in so many countries. So what we are doing now and in the next week, together with the Commission, we hope that we find really good ways forward, that this practice, together with everyone who produced it and who was involved and who showed that it's transferable, it's useful, that we can work further on with this high expertise with the Commission to find out if it can be used also at the EU level. But let's discuss that further on, and how, because the Commission is then using the expertise, is engaging with the expertise, and it might be that they would go forward with such a tool. We will see what is going to happen. It's up to us. How much do we want to go? How do we want to define it? Or each country would try to struggle on its own? Or do we really highlight the importance of this Slovene invention? But I will go into the very, very short presentation, because now when you have been presenting it all so nicely, I don't have a lot to say. Yeah, Monica. Okay. Next one, please. I would just like to show you now, again, this is our framework. We have produced it during those 3 years together. And as I said already before, you have been listening now to the elements of this framework. So with Austria, they started how they have been exploring the landscape and legislation. And then we have gone through the struggles of Greece and how they have been establishing intersectoral group. And then Hungary, how they have been working with the institutions, which are in fact implementing the public food procurements of food. And then we were together with that was Hungary. And then with the food groups, how Finland has composed, and use of catalog with Malta, and then how it was working with the industry, and then sustainability and the further developments together with Denmark. So that's all in here: landscape and legislation, networking. Then how do we approach, how do we implement, which tools do we use, and how do we evaluate, and at the end what we have produced. So we think that really, if we go next one, that are the building blocks. Now, if that could be implemented in the country, some overview or the analysis of the situation should be done in the beginning, and then in the evaluation cycles every here and there, so that we know what's happening, if something is new, if something new has been developed, any new tools, any new approaches, or anything like that. Then it's necessary to identify sectors, stakeholders, establishing intersectoral bodies. As Poland has so nicely said, we have to sit at the table and talk. Maybe we did a move forward because we really decided not to talk with the individual producers, but talk with chambers, talk with associations. And that was also a big learning from our Chamber of Commerce and Industries, that if the more of the producers are represented and have one voice, then these discussions are not inclusive or exclusive, I would say, for anyone also from private sector, but everyone is at the table then. So next point is that when we are already with networking, as Bettina so nicely said, and she will present some few more slides on that at the end of the webinar, network focal points, which are networking. And then the fourth point is knowledge building in public food procurement. We see that that's really heavily missing all around Europe, and also about the differences among us. So that's the next point. And next slide. The fifth one is that we are thinking of minimum criteria. If they are mandatory or not, we do not know yet. But at the moment, we have been working, because the Commission started with the idea of mandatory, but we do not know. So it's the criteria, the quality criteria, health, sustainable, equitable. It's something what Bettina has nicely presented, what everything is hidden behind the quality criteria. And also we are really thinking of possibility to input those data also to the GRC database, the FABLA one. We just discussed that with GRC again yesterday. So we know that this policy, of all of the nutrition policies, food nutrition policies, might be the most difficult, but in Ljubljana, at the meeting, we have been discussing that it might be possible anyway. So let's explore it further. We have the next 4 years' time. Then it's possible, could that be a dream, that kind of a public food procurement tool and all linked documentation would be prepared for the EU level, so that we retransfer this expertise? And I think that the Slovene case here is really an excellent example because it was proven now during 3 years that it works in the other countries. That's quite a rare opportunity that usually we just say we have a good practice, anyone wants it, but that you evaluate that it works, it's quite a big step. And then, of course, evaluations and recommendations. So here we are with, I think, quite a slight delay, but anyway, eager to go forward with the webinar. So the next slide is telling us what we are going to do. We wanted also to give you the time to chat a bit among yourselves about what we have done. So we want to create 3 groups. And hear your maybe general comments on this Work Package 7 framework, or if you think about any strengths, opportunities, or threats or weaknesses, it's also time to share, because we will be sharing all what we have of those inputs in Brussels next week with the policy decision makers in the forum and also in the policy dialogues with the EU level stakeholders. So now it's the great opportunity that you share that with us, or in the next 15 minutes, or during, or with in emails, or anyhow. So at the moment, I think that Albert, it would be good if we go to you and with the breakout rooms. So I think that my colleagues will just appoint us to the breakout rooms, and we have a short break or stretching at least while we are waiting.
We have a break first, and then we go to the rooms, or now we go to the rooms and then have a...
Yeah, good question. We just thought it would be best if we just break out to the rooms, and while that's happening, take a minute for promoting healthy habits. It means wake up, stretch yourself, drink some water, and after the discussion, the Zoom.
When do we have to get back? At what time? Maybe we'll have like 15 minutes for discussion.
Yes, 15 minutes altogether, and 14:45 we will anyway be back and report slowly, and then I don't know even if we do the reporting. 14:45 we are back, I think, and then we have Bettina's presentation, and we will catch up the outcomes. So without the reporting, because we have note takers in the groups, yeah, and then we have Bettina's presentation and finalists. Would that be okay?
Yeah, sure.
Okay, perfect. Thank you. It seems that some groups have been very active, and in some we have been a bit less active, but anyway, we had fun. We had good time together. Okay. And I'm happy that Barbara is also showing her camera, because few of the colleagues, isn't it, Barbara? They have been so nicely presenting what was the support from your side. So that's really...
Yes, thank you for that.
Yeah. And let's be in contact, because now I'm searching for our colleague at DG Reform so that we define how do they see it, how can we use the knowledge, and if they can employ that knowledge which is produced.
Okay, so I think everybody's getting back now from the discussion, so it's good. I think we have, yes, so I hope everybody has returned. So I think the question is now that, so we have a short feedback, right? A sentence from each, or
okay.
No, I'm just asking, should we skip, or do you want like have a one?
I think
we have no time, right? We're running out of time, so let's move ahead.
Albert, I think that we've had note takers in the rooms. So I've noticed that Monica was like started sweating because of the energy which was produced in the other breakout room, and I'm sure that everything will be transferred. So we are looking really very much forward to any of your suggestions, because next week we have the final dialogue. You all had the chance to participate in the dialogues in 3 parts of Europe, and now we are finalizing the one. So any message, any idea, please share it with us. But now and whatever you shared today, it will be note taken and forward to the further discussions. But I would go forward, yes, Albert, so that we finalize by 3 as foreseen.
Yeah, so then I think the next presentation is the Public Food Procurement Network. So this is the topic then, and I think Mojca is the word is now with you, right? So you will be.
I think that with the Public Food Procurement Network, the Bettina is
okay.
yeah,
Right, Bettina.
yeah.
So then Bettina, please. Yes.
Yeah.
Yes.
Okay, thank you. That can be done relatively shortly. I did the a presentation for you, so I will share it very, very shortly. And the presentation mode, here you go. So as you know, we have had the National Procurement Officer Network, which is linked to the ministry. In our breakout room, actually, we just talked about how hard it and that this work we did in oh, can you hear me?
Yes, we can hear you, but we cannot see the presentation. It's written that you has started sharing the screen, but maybe you were too early with the presenter's mode or something. So we see the black screen at the moment.
You don't see the screen at all?
Your black screen is
doesn't matter. It doesn't matter. I'll just tell you whatever. So what I'm saying is actually in our breakout room, we also talked about how interesting it's been with our project Best-ReMaP to show how untouched the national governments are with the cities and how hard we have been finding the procurement officers. And that's also what we saw in Denmark many years ago. Now we are actually, in all of us, beginning to loosen up to find each other. And this will be very, very important for the work forward. Like I said before, our next meeting in the European Food Procurement Officer Group that we built with this Best-ReMaP project will be on the 30th of May, because we will have almost a meeting every month. Now we will have summer holiday, I think, after June, but because we have in end June, beginning of July, and the rest of Europe has July and August. So I think we will meet again in September, but we will continue even when the Best-ReMaP project stop, we will. And even if the EU for Health did not start, we would still continue our EU Food Procurement Officer Network, because it's so giving. We saw that with the questionnaire we made, we could actually see that 50% of countries that are participating in the EU Food Procurement Officer Network are not doing a market dialogue when they are doing procurement. This is highly interesting. Some countries say that it's because it's illegal according to their regulations. It could be really interesting to dive into why do they think it's illegal, because by law in Europe, it is legal. So how can this, and that will become really nerdy discussion on the 30th. So if you're interested, then just please join, because it will be highly interesting, I think. I look at least very much forward to the nerdy discussion we will have. And we have seen that for the first meeting, we had around 7 countries. Now we have 17. And it is still growing. So every month, countries are joining. So it is so interesting, the work that we have built. And actually, that was the short news from the networks, because we are also running out. So I just wanted to give a but that's it. I'm excited. Very much, as always.
Wow, great. Okay. Yes, you are an inspirational personality, that's for sure. So it's good to have these kind of people on board, also at the webinar. Good. Yes, Mojca, would you like to add something to this?
Yeah, as always, that I think that what I already said in our breakout room is that I'm always excited, inspired, even seeing what has been done. I noticed that still I haven't catched all the details and all the efforts which was implemented. And here with the procurement officers network, I have to say that there is really a huge struggle behind, and it's so interesting. I would echo here with Bettina. How do we differ? So that's also moving some things in Slovenia, I might say, that we are exploring more, that we are linking more with the Ministry of Agriculture, with waste management, with different other angles of procurement which maybe were not so visible. But what I would like to share with you is that also the work at if the procurement officers are there where the hands are in the field. Then we have the national level also, where we have to link those who are transferring the national interest to the EU level and back. But what is also very interesting is that I was just approached by DG Agri for the school fruit scheme, where they are discussing the public food procurements, and they see also the potential of having school fruit scheme as the example how you could procure for that types of food which are in the school scheme. So there is this network level at regional, local, and then national level, where are the sectors, and then the EU level, where we should also find how the different DGs can collaborate in this area. So that's something what we are trying to do next week. That's my message, that we see the whole picture, all different layers. And thanks, Bettina, for the work there.
Thanks, Bettina, and thanks, Mojca. Well, I think we are coming to the end of this webinar, right? So I think the only thing we should mention is that the project is still ongoing, so we know we are there with this Brussels event, the European level policy dialogue, and then we'll have a closing event in Paris, the conference, and I think you can see all the information about these events on the website, Best-ReMaP.eu. I think this would be my only announcement. Plus, we should do an evaluation of this webinar, and I would share here the link to this webinar. So I would ask you to click on the link and then open it and spend a couple of minutes with evaluating of actually, is it the right link? Do you see the yes? Oh yes, exactly. Yeah, so if you can click on the link, or there is this QR code. Yes, there is this evaluation page, Google surveys. You can fill this in. Yes, so this was on our end.
In the meantime, Albert, I would really like to thank all the countries, because they have been presenting so nicely, and I cordially invite everyone to join us in Sarajevo end of this month, and beginning, I think it's 1st June something. I think that there in Sarajevo we still have quite a lot of very important work to do. So to discuss what to do with our case studies, how to best make the comparison analysis if we finalize them, what it's possible, how can we speak about the quality criteria, the criteria for public food procurement. So that's also quite an important point of the discussion, which we have to elaborate till July. And it's something what the Commission is also struggling with quite well. So time for us to do it. And I'm looking very much forward because the colleagues in Bosnia, they will be presenting us the kindergarten and the producer, and we will do a field visit, isn't it, Aida? So it will be lively and a lot of nice experience again. So before we get from Brussels to Paris, we will still be in Sarajevo. And we are also thinking of the roundtable on public food procurements on the end of August, very probably in Brussels, because we would really like to raise the attention to this area before we enter with everything to the new joint action. So nothing will stop us, or how to say. So that was also from my perspective, that thanks to everyone, and see you in Sarajevo, hopefully all.
Thanks a lot. Thanks, Mojca. So see you, all of you, in Brussels and in Sarajevo and in Paris, and then in the next joint action. I think, does anybody have any more comments, suggestions, proposals, or otherwise I think we can successfully close this webinar before 3, right? So which is excellent. So this is it. Okay, then thank you very much for your participation. We have really learned a lot. And then see you at the next event. We have still quite a few months to go until the end of September. Thank you very much. Thanks for your participation. Goodbye.
Thank you so much. Bye-bye.
Bye.
Thank you. Bye. Thank you. Bye.